I bring you greetings from the Louisiana TriParish Alumnae chapter of Delta Sigma Theta Sorority Incorporated, where I serve as the chapter president. Also, I am a member of the Southwest Region Program Planning and Development Committee, where I serve as the Subcommittee chair for the Physical and Mental Health Committee. I'm happy to share some words about mental health awareness and wellness with the Jamaica Alumnae chapter and their community. And I just want to share some words about the importance of managing our mental health, the importance of wellness. A lot of times attention is paid to our physical well-being, and I always like to mention that there is no physical health without the notice and attention given to our mental health and well-being. One thing the pandemic has brought forth, and something that communities definitely have to pay attention to, is the need for us to pay attention to when we're feeling stressed or overwhelmed, or when we're feeling sadness or more depressed feelings, or when we're feeling anxious or anxiety symptoms. And so one of the things that we should all be aware of is the amount of stress and uncertainty our community members have been under due to the pandemic. One thing, as we try and figure out how to manage the stress, we can look at those things that tend to release that stress that we're experiencing. I always find that when we go along the way and we have stress that's untreated, it turns to distress, which leads to multiple medical and chronic conditions such as hypertension. It can also lead to cardiovascular disease and stress. It can also lead to gastrointestinal problems with our digestive systems. And so we have to pay so much attention and close attention to managing our stress and anxiety. Anxiety is one of the most common mental illnesses that we see, and sometimes it manifests itself in a way where there's excessive worrying, excessive fear about things that people ordinarily do not have that persistent fear of. And so those symptoms can be manifest by a person having a situation where they have panic symptoms, where they experience a lot of rapid heart beating and heart racing. They can be diaphoretic, where they're sweating a whole lot. They can also find situations where they're having an upset stomach, where they symptoms manifest themselves more as a physical way than an emotional way. And so we pay close attention to that as an anxiety-related disorder, and we figure out, how do we manage anxiety when we know what it looks like? A number of things can be beneficial in managing our anxiety by working out. Exercise is a key factor for a number of individuals. They find that very effective and beneficial. Also, meditation, yoga is also another benefit to managing anxiety and stress. We also find that gratitude journals, just being positive, keeping a positive space, helps us to be grateful and thankful for where we are and what we have, and help us to remove some of the stress and the uncertainty and the fear that we may be experiencing. Other things that individuals can do to manage the stress and anxiety is to talk to individuals, professionals who may be able to help them to develop some strategies and some other tools, or maybe just have someone to listen to your thoughts and to your fears and to your concerns, and to know that they are valid, but just to give you a better way in managing it. We always talk about, sometimes there's fear and concern of talking to others about our problems, which is another thing that we address as we look at mental health and awareness, that we have to address the stigma among our communities. And so having talks like these and having awareness be brought forth as in the way in what we're doing, this will help communities to get along and to talk about it more freely, to talk about it more comfortably, as we're looking at it as a need for us to all have total and complete wellness and to not be ashamed. As we look at what depression looks like, depression can be a lack of interest in things that individuals once had such joy in doing. They can be withdrawn, they can isolate, they can have difficulty concentrating in a productive life that they once lived. You can find that that person is now having trouble functioning in their day-to-day activities. They sometimes can get real irritable or agitated. If you're noticing signs like this in your loved ones or yourselves or those who you come into contact with, it's always helpful to ask them if they're okay. ask them if there's something you can do. Sometimes it's insomnia. They just have trouble sleeping because they're sad or they're depressed or they're anxious and they're up at night and they can't find a way out and they sometimes feel hopeless. And so sometimes just sharing and giving someone a space to talk freely where it's non-judgmental is so helpful, it's so effective, and that they know they're not alone. I always like to share that an individual should know that they have the support of their loved ones and that they don't have to suffer in silence. And so if you can lend a listening ear in a confidential way, in a non-judgmental way, we can all seek to gain support from one another in this difficult time that we're dealing with in this global pandemic. Also, as I've mentioned about talking to someone in a professional setting is helpful. It's also helpful in depression symptoms and managing depression. And so if there's a situation where you feel like you're not able to get up out of the bed in the morning, it's such a task to get up out of the bed, you're not able to get through your schoolwork, you're not able to get through your work day as productive, then it may be a situation where and you've tried the coping skills that I've mentioned previously. Taking a walk, listening to your favorite music that keeps you in a happy space, talking to your friends that help you to distract yourself from the negative thoughts or the negative thinking, journaling, which is helping you to get out that thoughts on paper. Also, sometimes it's just sitting outside in nature and just being thankful for where you are in the present moment in time. If all those things are being done and you're finding that they're not effective or beneficial, then that's when it's time to seek the professional help from an individual who can help you to develop more coping skills and strategies so that we can all be resilient through this time. It is not easy. We know that, but we know that we can get forward. We can move forward with the help of those individuals, our loved ones, and the professionals in our communities. I encourage each of you to take a self-assessment and also look around at your friends and families and loved ones who you may know may be struggling in silence. Offer them a safe place to talk to you in confidence, and maybe you can also help to bring them to the situation or the point in which they can get help that they need. I thank you all for allowing me the opportunity to share, and I hope that you all recognize the importance of paying attention to our mental health and well-being as we pay attention to our physical health and well-being. Thank you.